This is Reah, and this is Just the Who of Us, where we talk about a range of topics including life events, current events, spirituality, entertainment, family relationships, as well as answering listener questions and more.
Good morning and welcome back. Today we have Nidia back with us to talk about ADHD and trauma correlation. Nidia is, if you didn't see her last episode, she is a counselor who specializes in anxiety, depression, trauma, ADHD, and couples work. And welcome back. It's been so long since I've seen you.
A long time.
So today we're going to talk a little bit. We kind of briefly mentioned ADHD in her last episode, and today we're going to kind of dive into that a little bit more in depth. If you missed the first episode, one of the things that really drew me to you as a guest was the fact that we had so much in common with the very beginning of our lives, both being children of divorced parents. We both faced some pretty traumatic events in our early life, and we both went on in our adulthood to focus on mental health and how we can kind of take the things that we've learned and experienced and help others in the world get through the things that they've been affected by, whether it be trauma, certain diagnosis, or even couples therapy or couples work. So, welcome back, and let's jump right in.
Yes. Man, where should we start with ADHD?
Let's talk about how you apply your ADHD diagnosis in your professional life. How do you use the knowledge and your life experience that you have in your counseling of others through their ADHD diagnosis?
Yeah, so it depends if they're coming in as individuals or they're coming in as couples. But one of the things that I like to do, let's say they're coming in individually, is to assess how the symptoms of ADHD are impacting their life, right?
Mm-hmm.
Most of the time when people come in, it's because the symptoms are really impacting their productivity
Yes.
in some area. It could be, if you're a stay-at-home mom, then it could be like cleaning the house or making sure things are organized, right? Like the schedules for the kids. If you're someone who works outside of the home, then it would probably be not getting projects done or turning in everything at the last minute, and then they're incomplete or they're not done specifically how they needed to be done, right? So we need to see where is productivity being impacted the most. And that's
Yeah.
where we start looking at, okay, like what systems, if any, do you already have? And how can we adapt them to specifically to you, right?
Yeah.
So, and what I mean by systems is time management, prioritizing, being able to stay organized with not just, home things, but organized with the materials you need to do your job. I work mostly with adults, but I do have a couple of teenagers, and with them, it's about school, right? Like
Yes.
how is it impacting you at school? Is it the impulsivity? Is it not finishing uh, homework? Things like that, right?
Right.
So, yeah, when I talk about systems, it's about like what tools are you using to improve your executive functioning, which is what it's impacted in ADHD. So executive functioning basically is our ability to regulate our emotions, regulate and sustain focus, being able to organize yourself, keep your materials organized. I don't remember if I said prioritizing, but prioritizing tasks, being able to keep up with time, right? Being able to move in and out of tasks without feeling dysregulated.
Yeah.
And yeah, so those are the things that our executive functioning it governs, right, in our life. So I want to see like how is the ADHD impacting you, and which one is your strongest and your weakest executive functioning?
You know, ADHD presents itself pretty differently in adults and children. However, we have the same kind of standard, I don't want to say issues, but standard focuses, right? So, like a lot of these I noticed in my son, I have the same thing, but they present a little bit differently in me.
Right.
Because I'm not in school to have these focusing issues, but it can impact my work life or, even my relationships, my relationships with my kids, my relationships with my husband, co-workers, whatever the case may be. And so a lot of times it's easier to see it in kids because you see, primarily, okay, they're having trouble with schoolwork or, paying attention when there's all these noises going on and all these things around them. But for an adult, it might be difficult. It might be more difficult to notice it because it doesn't stand out as much. I know for me, a lot of it is kind of more internal than say my son who is in school. A lot of these factors are external, right? Um, can you briefly tell us kind of the the basic criteria for ADHD in kids versus adults?
Yeah. And also there's a difference between boys and girls,
Yes.
which is
Yeah.
why most girls will go undiagnosed.
Hmm.
And we have a generation of lost women who were not diagnosed as children, right?
Yeah,
Probably
I've met
around
multiple
your
women.
age, yeah,
Yeah.
that got diagnosed in adulthood, right?
Yeah,
I
one was I think 50.
yes, yeah.
Mhm.
And then it becomes harder because of, doctors not like wanting to see other things, which is fair, right? Like what other
Right.
things are contributing to this?
Yeah.
But some of the symptoms, well, one, the symptoms need to be happening in two different settings. So for children, it could be school and home, right?
Hmm.
For adults, it could be home and work, or relationships and work or home, but it has to be happening in two different settings at least.
Okay.
The other thing for children is an inability to sustain focus according to their age,
Hmm.
right?
Right,
But there's
right,
also emotional dysregulation. Um, and the symptoms shouldn't be accounted for through like something else medically that is going on with the child,
right.
right? Um, uh, Also, so there's the focus, there's the man, I'm losing track of my thoughts. Um, well, for adults, the symptoms need to be present for at least 6 months, but they also need to have happened during school age, and
Okay.
preferably before age 12.
Hmm.
Okay, so like for adults, you may need to have either your spouse or a parent, if they still remember, a manager that can complete a questionnaire about your behavior and your symptoms, because a lot of times we develop strategies to compensate for whatever we're struggling in our executive functioning, right?
Very much so, yeah.
So we need other people to also tell what they see, but the symptoms need to have been present for at least 6 months and be present during school age. Yeah, I'm not sure if I'm missing anything else. We also have issues with understanding time. So
My
we're
God,
usually
yes.
pretty late. We have trouble estimating how long something's gonna take. So either we underestimate it or overestimate it. Most of the
Yeah,
time it's underestimated.
very much
That's why
so.
we're late, right?
No, it's funny because in my house there we have real time, we have ADHD time.
Right,
So, and also I don't know who else does this, but I round everything. So like if it's 12, like 12:36, okay, it's almost 1 o'clock. Like
right,
there's no like, oh, it's 12:36. What time is it? It's almost one.
right,
If it's 12:06, it's about 12:30. Like I don't know what it is, but my husband is like, no, it's only 12:37. We have what, 13 minutes left. Like, or
right.
yeah, 23 minutes left. See, I don't even know. It's almost 1 o'clock.
Exactly. Yeah. Which, whenever we have something to do, for example, like if I had something to do at 3 today and I
Mhm.
wake up at 7, then I can't do anything because I have something to do at 3, even though
Yeah.
it's like hours, right? Apart, I'm
Yep.
still thinking like it's not gonna give me enough time, right? So
Yeah,
a
yeah,
lot of times we get into this procrastination, which is another one of the symptoms. But it's because we cannot measure time,
yeah,
right?
yeah. It's funny that like I've been late my whole life, but it wasn't until my husband, until I was like close to 30, that pointed this out to me. Like, no, like you don't have any sense of time. Like, no, like you need to allot an hour for this, an hour to an hour and a half, kind of thing. And I'm like, oh, just give me 15 minutes. He's like, no, like you
It's
allot
you
an
can't
hour
do it
for
in 15.
me.
Yeah.
Like even getting up sometimes, I'm just like, okay, we have to leave at 7:45. I can get up at 7:15. And he's like, no, like
Talking about,
because to me, he doesn't have ADHD. So he gets up an hour, hour and a half, probably maybe 2 hours sometimes before he has to be anywhere. And I'm like, that's so much time. Like
right,
to me, it's like it's too much time. Now my brain has this gap in time. What am I supposed to do with that?
right.
Like now I'm just here. I can't do that. I can't do that. So
Right, because then you get started with another task and then you get caught up with it and then you don't do what you actually said you were going to do at the time you said you were going to do
exactly.
it, right?
Exactly.
Right.
Yeah.
Yeah, yeah. Uh,
Yeah.
yeah, so I had to open up the diagnostic criteria because I was like, I'm sure I'm missing something.
Hmm.
Um, but you have to have at least 6 or more of the symptoms. So one of them would be, like I said, difficulty with sustaining your attention, careless mistakes, forgetfulness. And I have an issue with that careless mistakes. I don't feel
Yeah.
like um, it's not a positive reframing, right? I
Right.
feel like
Maybe
it's
like
not
simple
careless.
mistakes or
Yeah,
something.
simple
Yeah.
mistakes, exactly.
Yeah.
Yeah, like maybe not proofreading your email before sending it or clicking send too fast, right? Like I know I do that
Yeah.
a lot of times.
You-
Um,
I've noticed that I drop stuff a lot or like knock stuff off of things a lot. And
yes.
my son, he'll be in his room and I hear stuff falling all the time. And sometimes I'm like, why again? And then the next thing I know, I'm like kicking the remote off something or something like that. And I'm like,
Oh
oh,
my God. Yes.
it's
Yeah.
because I'm
Well,
not paying attention to where
right.
the remote is or whatever the case may be.
Yeah, so one of them is not being present, right, which leads to issues with working memory, which is another part of our executive functioning.
Yeah.
Uh, but also part of it is a lot of us have issues understanding how our body is in space. So
Mhm.
we run into things a lot of times. We're very prone to having accidents because we just don't understand how much space our body takes.
That's yeah. That's such a big one too. The clumsiness factor.
Right.
I see like videos all the time, like TikToks and stuff of people like hitting corners, like hitting door frames and all these things. And I'm like, that's why I have like random bruises all over my body because I'm always like bumping into something.
Right.
I'm walking too closely or whatever. Like,
Right. Yeah. And then the opposite of that, right? So that's like our space in the world, but the opposite of that is understanding what's going on inside of us. Like a lot
yeah,
of us, I mean, I didn't know what it felt to be hungry until I was in my teen years. I
yeah,
didn't know how to measure hunger, or if I was thirsty, like how do people know they want to eat, right?
right.
And also, we don't go to the restroom when we're supposed to go. We may hold it in for long periods of time. Like I've been holding it for probably 2 hours right now because
It's,
I'm not paying attention to it, right?
yeah.
But those are the other things that we may not understand that are happening inside of us. Like, what am I actually feeling right now? Right?
hmm
Am I frustrated because I cannot get this done? Or am I feeling overwhelmed because there's just so much that I need to remember to complete this specific thing, right?
Right. Yeah, one thing that's been a huge help for me is my calendar. Like if I don't write it in my calendar, it doesn't happen. It just
Right.
doesn't exist anymore.
Yeah. So those are the systems that I like to work through with clients, right? Like, what do you have in place? How is it working for you? Are you still forgetting to do things? Are you still leaving things to the last minute, right? How are
hmm
you using those tools, whether it's a planner or a digital calendar, right?
Yeah.
Mhm.
Yeah. I you know, I, there's this also kind of, and it happened with like OCD and different things. There was peer, everybody's like, oh, I have ADHD. Oh, I have OCD. I have anxiety. And a lot of it is just misinformation, right? Like,
Yeah.
okay, well, if I have one of these things. I'm a little forgetful sometimes. Well, I must have ADHD.
Right.
It's really important, and I'm glad that you point out two things, that there has to be six, and there has to be kind of this outside observance. I know that in children, when you get an evaluation done, it starts, you get the packet or the stuff from the doctor, the teachers, or I think it's two administrators also have to fill this out along with the parents. And so that's because, well, you need that outside observation to also match up, like you said. And then with adults, I didn't even know that it was the same way, but it makes complete sense because it's like, sometimes these other things can be attributed to other
Right.
diagnosis. And so it's really important to also not just assume, because then you can't get proper treatment. And without proper treatment, sometimes these things they won't go away, and they'll keep impacting your life in ways that make it more stressful and difficult. So obtaining a proper diagnosis is really important. And I talk about this a lot on my podcast too, that like uh getting valid, reputable, and scholarly information is super, super important. This is one thing that you really don't want to be misinformed about
Right.
for various reasons, but it's really important to obtain valid information. And where can, other than, going to just your general practitioner, where can, say, an adult who feels like they may have ADHD go to get answers on that, or, obtain a potential diagnosis or get more information?
Yeah. So a lot of adults start this path by going to a therapist, right? But depending on the state that you're at, a therapist may or may not be able to diagnose you. So they will refer you to either a psychologist or a psychiatrist. And
Yeah,
the psychologist is trained to do all of the psychological testing, right? The psychiatrist can diagnose you, but they focus more on medication management.
right.
So I would say with a psychologist is your best bet because they're not only going to um, rule out the ADHD, but they're also going to look at other things that could mimic the symptoms of ADHD, right? So like, I was diagnosed with PTSD and ADHD, and they can look very similar, but there are a couple of things that you will see in one, but you will not see in the other, right? So it's important to go with a psychologist or a psychiatrist who specializes in ADHD or neurodivergent diagnosis like autism and ADHD.
Yeah, I appreciate that information. And I think that's important too, because there are other, like autism, there are other things that, are on this neurodivergent spectrum. So, it's just really important to contact a professional. And there's different modalities of treatment as well, which used to not be the case. So like when we were younger, there were less options, and now there really are a lot of options. Like when my oldest was younger, therapy wasn't a thing, and now with my 10-year-old, we actually started therapy before we started medication. um, and I think it's a really great combination, because while medication can be very beneficial, things like coping skills are also going to be just as beneficial. And, in my opinion, when you're taking medication, but you're not working on coping skills, anger management, and things like that, you're kind of, you're not getting the complete care that you could be getting.
Right. And I would even say like you could have a multidisciplinary team, right? You could do occupational therapy for ADHD if there's a lot of sensory things going on.
Yeah.
You could do or you could work with a nutritionist, right? Let's see
Hmm.
what foods exacerbate your symptoms, so which ones make them better, right? You can have your therapist, your psychiatrist, your primary doctor, right? Like all of them could be helping you to work on the symptoms,
Hmm.
and one is not more important than the other one. All of
Right.
them contribute to make things better.
Yeah, we started weeding out artificial dyes for our 10-year-old, and we noticed the difference. Like you can, if he eats certain things with certain dyes, and even for myself, right? Like if we eat certain things with certain dyes, like we can tell a difference on how we feel, how we act. It's one of those things that's like kind of crazy, because some people are like, oh, whatever, and then some people are like really serious about it. And I'm like, my son's grandmother told me the other day, she's like, I'm really glad that we learned about this, because like, then that whole mom guilty. Well, I wonder what if I would have known about this when my kids were, were little. Like,
Right.
but it's also something that you don't know unless the information is put out there. And so,
Exactly.
I want to briefly touch on the correlation between trauma and ADHD. And I know that when we learn about ADHD, we learn more about the chemical imbalance, and that's the kind of primary focus. And I don't think that there's a lot of talk about the correlation between trauma and ADHD. Um, when we think about chemical imbalances, we think, okay, well, that happened when you were born, right? But there's a lot of things that scientifically, when we look at our brain makeup, when we look at the chemicals in our brain, when certain traumatic events happen, some of that chemical makeup can change. And it causes kind of almost little fragments, right? It can cause other things, memory loss or memory suppression. And in ways that, like, well, my memory was good before, and then something changed. Or the way I responded to someone touching me, the way my body physically felt, the chemicals that are released when someone touched me before as opposed to now. there's a lot of there are a lot of scientific changes that happen within your body when you experience trauma, and specifically at a young age. um, and like I said, it's not like this, to my knowledge, it's not like this profound correlation, right? And I think there's a lot of people who will still say, no, it's strictly this chemical thing that happened in your brain when you were born. But I think those of us who have ADHD and have experienced trauma can kind of attest to the possibility that there is a large correlation here. And I know, we talked in your first episode about our uh, traumas from when we were our childhood traumas and the fact that we both have ADHD. I've talked to other people who have been diagnosed with ADHD, and they also experienced some kind of trauma in their childhood. Not every single time, or at least not every single time was it a trauma that they felt or something they felt was a traumatic event. But we know it could be something as simple as your parents divorcing. It could be, it can be something that, and even for me, realistically, because my grandmother was divorced, my mother was divorced. So for me, me getting divorced may not seem like a traumatic thing to my child, you know, because I'm kind of used to it. But to my child, it's traumatic to them because just because it was, you know. I want to briefly kind of touch on that correlation and what you've seen in your career, your professional experience, and even your own personal experience of that correlation between ADHD and trauma.
Yeah, so there's two school of thought. One would be that trauma can create ADHD-like symptoms, or that ADHD is actually a trauma response.
Mm-hmm.
And then there's another school of thought, and I'm gonna say like this one, it's more new, and I don't buy it all because of this other school of thought, which is a neurodevelopmental disorder that happened in your mother's womb and it's genetic. So we don't necessarily know why it happens. We just know that the prefrontal cortex, this part of your brain, is not developed fully, which is why we have issues with impulsivity, because that's the part that it's not fully developed when you're a teenager, right? And you end up doing risky stuff. It's supposed to stop developing around age 25. And I think more research has shown that it's not until 30 that the brain stops developing. But this school of thought believes it's genetic, and there's a lack of dopamine. So people with ADHD naturally have lower levels of dopamine, which is the reward chemical. So unlike other people who complete a task, like neurotypicals, they complete a task and they get this release of dopamine. They feel like, okay, I accomplished something, right? For us, neurodivergent, it's like I completed, but I feel a sense of relief because it's no longer in the back of my head. I've been putting it off for so long, right?
So I can take it off my to-do list.
Right. Yeah. So there's not really a sense of accomplishment. And so having low levels of dopamine has also been attributed to experiencing symptoms of depression, right? So in trauma, our brain does, especially if it was childhood trauma, our brain does suffer changes physically, like that you can see. And that's what can generate the symptoms of ADHD. If it's preventing your brain from fully developing, right, then it's going to impact you. And like I said, I think it was in the previous episode, with ADHD, we're 2 years behind developmentally, right? So with trauma, if you were neglected, you may already be developmentally behind because of the neglect. Right. And that created changes in your brain, which then later is going to create symptoms of ADHD. And it's been studied. So Russell Barkley is the psychiatrist that researched ADHD, I believe, for like 40 years. So most of what we know about ADHD is because of him. And So he did several different studies, but one of them was that children who were treated for ADHD um, as children, right, like at a young age, have a higher chance of having their symptoms under remission when they're adults.
Hmm.
And they also have lower chances of developing addictions. Because when
Yeah.
you don't treat it, and if you become an adult, right, you have higher chances of having depression and suicidal ideation. You
Right.
had higher chances of having anxiety and being a victim of trauma. So ADHD makes us propense to trauma
Yeah.
um, because we're impulsive, right? We're
Right.
just making decisions based on how we feel rather than what are the consequences.
Yeah.
Um, so, um, yeah, sorry, I've been losing my train of thought today, but
You're fine.
uh, but oh yeah, and then we have higher chances of becoming addicts, which may not be on the normal sense of the word, right? It can be workaholism, it can be
Yes.
eating disorders, right?
Yes.
Or substances.
Yeah, but I think that's really important to point out because when people think addictive or addictions or addictive, I can't talk, addictions or addictive tendencies or behaviors, they automatically think drugs and alcohol. And, cigarettes are an addictive substance, overeating, uh, porn addictions, like there's so many other
Right.
things, gambling addictions. There's so many other things that are addictions or, that present addictive tendencies outside of drugs and alcohol. Sex, is one. So it's really important to point that out as well and to kind of acknowledge that, that um, and while it is as the ADHD coupled with trauma, but you also make another good point of we kind of forget that we inherit things, right? So if I go through trauma and I'm pregnant, or while I'm pregnant, or I'm, it's still residual from before I became pregnant, whatever the case may be, and I give birth to a child, I'm also carrying some of that on to them, right? And so,
Right.
this is why it, I think ADHD is kind of quote unquote passed down because, well, we're also passing down the trauma, we're passing that lack of dopamine, we're passing down that chemical change, and so yeah, I think those are really really important things to point out.
Mhm.
Um, I would love to talk more about this, and I could talk about it all day long, but unfortunately, we are out of time. So, but don't worry, she'll be back. I think our a kind of little peek into our next conversation, we will be discussing neurodivergence, versus I don't know what's happening. My brain is malfunctioning.
See,
Neuro,
mine too.
neuro, neurodivergence versus neurotypical, and adapting, um, tying also tying this into coaching through couples therapy because as you pointed out, like our ADHD can 100% affect our relationships. It affects us, but it also affects those around us and how we move, how we behave, how we even react to things. And so I'm looking forward to that conversation. So stick around and make sure you guys listen to that one. And let everybody know where they can find you.
Yes, so I am on TikTok as Nidia11, and you can find my link tree in there. It has my Instagram and my Facebook web pages or pages. And then my webpage, it's springoakscounseling.com. And I do therapy services for Texas and Florida and relationship coaching around the world.
Perfect. All right. Thank you for being here, and we'll see you next time.
Thank you.
Check us out on YouTube at Reah Higgs, ReahHagues. You can also keep up with us on Instagram at Just the Who Podcast.